name is Sandra Reyna, and I'm an assistant professor at the University of Utah from the Department of Neurology. How I became involved in alternating hemiplegia of childhood was back in 2001 when I met with Dr. Catherine Swoboda, and we started working together on this disease. And the reason why I got involved, it was really, it was an amazing opportunity that I literally got through Dr. Swoboda by working with a family in Puerto Rico. And because of the obvious linguistic skills I have with Spanish, it helped with this family. And so that's how I got sucked in. And it was just an immediate attraction of my interest in becoming involved in such a rare disease. And so I've stayed involved ever since. I fell in love with the fascination of the syndrome and how devastated it was for the families that were affected by this, and the fact that there was nothing out there to help them. It really just, kept me very involved. And so I've remained involved ever since. And it became part of the Alternating Hemiplegia, of Childhood Foundation. By definition, it's a very complicated disease, a neurological disease that affects mostly children. And now, when you try to define this disease or syndrome to a family member, it's become more and more complicated simply because no AHC child is the same from one to another. So what is it really? It's a combination of very complex neurological symptoms coming, starting from possibly doing some spastic movements of the eyes, of the body. It can involve all the muscles in the body where it simulates that patients could be having a seizure. And so it is very confusing for the community, including the medical community, on diagnosing what AHC really is. So is there a clear definition of it now? There's an understanding of it, but I don't think that the definition has been pretty much set out front so that the medical community can diagnose quicker. And the disease itself calls for so many different options of treatment because of the presentation of the disease, right? So if you think that your child is having a seizure and it's an AHC affected child, then they're going to treat him for seizures. If they think that the child is not relating well to another child of the same age with certain autistic characteristics, then they're going to treat him like an autistic child. So is it a complicated disease? It is. Is it well defined? No, unfortunately not yet. And that's our goal right now, is to come up with a clear definition of what symptoms do really present in AHC versus other similar diseases that could mimic AHC. So our goal is to, through these meetings that we're having now and these medical workshops that we're having, our goal is to do a phenotypic definition of what AHC really is, and describe what a tonic, clonic seizure will look like, so that parents can relate to physicians and use that definition as it is. And not only that, but also that we as, in the medical community are also diagnosing under the same language what exactly we see and describe it just like that. And so the idea is to get, a consensus of what is AHC and what are the symptoms and what do they look like and what should they be called. So it's really coming together as a medical community in coming up with a plan on helping parents be able to understand the disease better, and not only that, but also understand it and describe it the way it should be, so that we're all on the same page when describing, AHC. From my point of view, since the time I've been involved, if you think about it, in the last 13 years, there's been more understanding of AHC clinically, a little more awareness of the disease. But has there been a clinical treatment for it? No. I think that many families are desperate and very much in need of some kind of medical understanding of the syndrome, and at the same time trying to find a medication that can help them. And so it's been a lot of trial and error by finding medications that maybe could subside some of those episodes they present. If not totally, get rid of the episodes, at least have them not be so frequent, right? So the goal of any medication that's being tried right now is to really alleviate that pattern of episodes they present, and not only that, but also the period, how long they are staying in this, present. Is nothing beneficial for the child to be under those episodes for a long periods of time. So we want to, minimize the number. So has there been change? Not very much when it comes to treatment, but I think more awareness has definitely come about since 2001 to this point, specifically after the gene was described, and now we have a gene to speak about. And that really has involved many, many more scientists, and it has attracted others who are working on a very similar disease and trying to compare notes to see if there's any similarities close enough that we can work scientifically to come up with a therapeutic option for these families. A really bad episode on the children that we have seen are children who are in the full body, contracture. And that's probably the best way to describe that, because again, it can be very similar to a seizure, but these children are totally embodied by a spasm that it affects their breathing, it affects their speech, it affects their also ability to eat. So the episodes that we have experienced with some of our patients, those patients really stay in that contracture position for a very long time, and it's extremely painful. And you can tell it's painful because some children are screaming, and it's a scream of pain. So this is very, very hard to watch. On the medical side, it's very hard to watch a child go through that. I can't even imagine what the parents are going through. So we've had some patients that are so severely affected by an episode that they have to be given medications to try to subside that spasm. And a lot of times the only thing that will do this is by putting the child to sleep. So giving them a medication that induces sleep, it really helps relieve that episode. I really believe that we have just opened the door. The door has been opened by finding a gene. And that alone is a huge opportunity for us to understand how the gene works and where do we need to go to fix the gene. So that provides a therapeutic window, right? So looking ahead, because we have now so much interest coming in from other groups, this is a disease now is being studied worldwide, which is impressive. Now we have Japan involved, we have Germany involved. Many European countries are part of this. The whole USA is involved now with AHC. And so do we have hope? Yes, we do. How quick can we get it here? That's a question that every parent has in their mind. Can we make this work much quicker than we're doing now? It's very hard. So we've had many scientists present on this, and now we even have biochemists looking at it in trying to develop a compound or find a compound that could be formulated directly to treat the mutation that we know exists. But having said that, there's one mutation that has been found in many children, but we're also finding that there are other children who are different in the mutation that they may present or not. And so what does that mean? Well, that means that this child with AHC is also genetically made different than a child who has the one mutation that we did find. because even if that mutation is there, there's also 3 different parts of that mutation that it's affecting the children differently. So it opens a window, but at the same time, we have a lot more questions to answer. And it's not an easy process. It's a very long process to try to figure that out for the families and finally come to therapy. We do need more people involved. If there's one thing that I think the medical community could ask for, it would be to have triple the amount of doctors and scientists working on this. Mainly because there's so much work to be done. And the fact that we are now comparing notes with the rapid onset dystonia group, which ROD is just incredible, or RDP is just incredible community, and they have done so much work already. So the idea would be to get those groups working together, come up with a animal model that could help us answer questions when it comes to therapeutics. And in any time that you're trying to develop a new compound or find a new compound, you have to have some kind of an animal model to go from, so that we can take the studies and experiments done in animals to humans. In the FDA, it's the only thing that they're going to be looking at and accepting, is that we have gone through all the phases of drug development in order to come to therapy for these children. So yes, we need as many people as we can find that are interested in this syndrome to help us find a cure for the families. Well, I have to say, the fact that the different foundations are coming together to do this, and the fact that we have so many families around the world affected with alternating hemiplegia, it's incredible when you think about the incidence of the disease. I think it's going to change. I don't think the incidence is as true as we know as it stands right now. So 1 in a million. When you think about how many families are now reporting some of these symptoms and they're being diagnosed with AHC, I think that number very soon we're going to have different numbers to report on, because it is becoming more frequent, and we have more and more families who are being now included in registries. So that alone tells you that something is happening, and so we need to hurry. We need to hurry and find a cure.